I'm live now. Hey, welcome everybody. Welcome to Back Talks with Dr. Sean McWilliams. Happy Wednesday to you. We're going to be talking about a cool subject, and that is how to reduce or prevent yourself from getting the flu in 2025. Thought we'd mix it up just a little bit today. Of course, I'm going to throw some spinal health in there for you as well, because I always do. And I hope that you enjoy this, and I hope I bring some great content. So how do you go about preventing the flu in 2025? Well, let's talk about it. Let's get into it here. So first thing that a lot of people do, and I'll put myself back on here, is getting a flu shot, right? That's a way of trying to manage this. A lot of people go that route. If you're more natural, then you may not want to go that route. So I'd like to give you some options, but I think there's a couple things that I would like for you, no matter what your decision is, when it comes to getting a flu shot, and that is to understand a little bit about the flu shot so that you feel like you can make good informed decisions. And so let's chat about that for 1 second here. So we'll get to there. So one of the things that the flu shot has in it is a preservative called thimerosal, and just hear me out on this because I want to make sure I define it so you get it and I say it correctly to you. So thimerosal, this is from the CDC, thimerosal in flu vaccines, and thimerosal is an ethyl mercury-based preservative. Okay, so it's made from mercury that's used in the vials that contain more than one dose of the vaccine to prevent germs, bacteria, or fungi from contaminating the vaccine. That's what thimerosal is. And so a little bit more about thimerosal. The preservative in the 2024-2025 flu shot is thimerosal. All right, make sure you hear me though, this is important, but only in the multi-dose vials. So if you want to go get the flu shot, what I want you to ask for is what you see, Amy, I have circled here, the single dose vial or the pre-filled syringes, because they do not contain the mercury derivative thimerosal preservative. Okay, so you want to stay away from that stuff. Mercury, we know, is not good for us. I know my title says vitamin thimerosal. Sorry, couldn't get that fixed in time. It's not a vitamin. But exposure to mercury, even in small amounts, may cause serious health problems. We know that they cause serious health problems. And it can be a threat, obviously, to the development of children in utero and early in life. But mercury, I don't know why they say this, we know mercury has serious toxic effects on the nervous system, digestive system, immune systems, and on our lungs, kidneys, skin, and eyes. If you know anybody that has ever had heavy metal poisoning because of mercury or lead or nickel, they are very, very, very sick. Their brains and bodies just do not work, and it can take a long time to get that stuff out of them if they're successful. So what's the key? Don't put mercury in your body. All right? We know that it's incredibly toxic to our brain and to our nervous system, and we don't want you winding up with Alzheimer's or dementia or any other kind of heavy metal poisoning, okay? So keep thimerosal and keep mercury-based products out of your body. And I'm going to show you a couple ways to do that as well that you might not realize you're getting it from. So that is one way that you can stimulate your immune system for the flu. But are there other ways? Well, yeah, of course there are. There's always other ways. So vitamin D, it's one of my favorite vitamins. So let's chat about that. If you've been with me, we've talked about it before, but I brought some new stuff for you today. So let's look. So first of all, what is vitamin D? Well, it's not a vitamin. It's a pre-hormone. All right? It's a pre-hormone. It tells your hormones how to work. It regulates all other hormones. And if I get you on my slide, you'll actually be able to see what I'm talking to you about. So it regulates all other hormones. So it's vital for it to be at optimal levels for you to have optimal health. And I'll show you what those are in a second. Almost all cells in our bodies have vitamin D receptors. Did you know that that is about the only vitamin receptor on any cell? So we know that vitamin D is way more than just a vitamin. It is telling almost every single cell inside of our body what to do and how to regulate itself and how to regulate our hormones. So vitamin D is critical for preventing the flu, from preventing colds, keeping your immune system strong, but also for feeling amazing and for your spinal health as well. So check this out. Can vitamin D reduce your chance of colds and the flu? So this is from the Harvard Gazette. This is from Carlos Camargo. He is in the Department of Emergency Medicine at Massachusetts General Hospital, and he was the study's senior author. And he said, our analysis have found that it helps the body fight acute respiratory infections, which is responsible for millions of deaths globally each year. And it can dramatically reduce your risk of respiratory infections by almost 50%. I'll take that, right? For getting a little vitamin D. Vitamin D is cheap too, so it's not even like an expensive thing. So you want to get your vitamin D levels up to speed. So is it important? Here's my, I'm always going to throw something in about the spinal health because, your spine and your nervous system controls every part of your body. The healthier it is, the healthier you're going to be, the more sick and diseased it gets, more sick and diseased you're going to be. Just watch people that have really degenerated spines. They're usually not really active participants in life anymore because they're suffering, and every tissue in the body suffers because the nervous system controls them all. So is vitamin D important for your spinal health? Well, yeah, of course it is. Vitamin D acts as a signaling pathway to reduce inflammation in your spine. That's super big because when most people have back pain, they have inflammatory processes around their nerves. So you got to get on your D to reduce that. It reduces oxidative stress in the intervertebral disc. That means that the things that go in, the Pac-Man that start eating our body away, called free radicals, gets neutralized when we take vitamin D. So especially in our disc, we don't want free radicals going in there and destroying our disc. We're trying to get our disc to be healthy, not the opposite. So D is critical for spinal health. It delays aging. I'll take that. And the death of cells in our spines. And it reduces end plate calcification. Okay, maybe you never heard of that, so I put a picture in here for you. So what is the end plate? Well, the end plate is this gray area that you see where I've kind of colored in here. It's this gray piece right here. And it is the top and bottom of the disc. And believe it or not, it can actually get fractured. And it gets fractured called a Schmorl's node, where this jelly that sits in here can actually protrude through that. You don't want that because it means that you're being really rough on your spine and you're fracturing your spine. So we don't want end plate fractures. But if you look at these little things I've circled right here, these are called your marrow cavities or marrow channels. And their job is to deliver blood from these blood vessels through these little tunnels to get blood supply, oxygen, nutrition, water, hydration into the disc and get rid of all its waste products so the disc can be healthy. Well, if you get end plate calcification, then these start to become calcified and they're no longer like straws to get blood supply in and out. And so now we start reducing blood supply. So another one of the benefits for you is if you take vitamin D, it prevents calcification of your end plates. Bet your surgeon didn't tell you that. So I'm telling you that because I want you to be healthy naturally. What else do you need to know about vitamin D? Well, here's a map of the United States, and if you've been with me for a while, I live in the Atlanta area. If basically you live Atlanta or north of that line, you must supplement with vitamin D. It's imperative. If you do not supplement on a regular basis, you are deficient. And deficiency causes all kinds of issues. Anxiety, depression has been very big studied with low vitamin D levels. Weakened immune system, all the stuff we just talked about with the spine as well, preventing antiviral type things. So a whole host of things go wrong in our bodies when we're low in vitamin D. So if you're Atlanta or north, you got to supplement. So is sun the only source of vitamin D? Of course not. So I'll show you some other ones. So here's your top 10 vitamin D sources over to the right, but let's look at the top 3 if you just want the cliff notes. Sunlight, number 1, cod liver oil, number 2, and salmon. God, my dad used to make me take cod liver oil when I was a kid. He must have known something I didn't know, but God, it was disgusting. And we had to chew these like yellow things, these yellow tablets. Like what parent would make your kid chew cod liver oil? But my dad did. I love you, buddy. Thanks for doing that. And salmon. So look over on the right here. Sunlight, number 1. Number 2, cod liver oil. Number 3, salmon. And for God's sake, please stop eating that crap farm-raised salmon. That stuff's so bad for you. I know it tastes good. Well, they farm it that way. It's so bad for us. Please, please, please start getting wild-caught salmon. All right? It's so much better for you. I don't eat wild-caught salmon or fish or shrimp. And I love all of those, okay? But I get all those wild-caught. It's way better for you because no one's putting colorings and preservatives and all kind of other crap that you don't know what they're putting in that fish to make it taste good. And, you know, it's like our chickens these days, you know, that are raised in cages. So please get wild-caught salmon from now on. Mackerel's really good. Tuna is a good source, but remember we were talking about mercury poisoning. I want to make sure you can see me. Yep, I'm on the right side. So mercury poisoning is very high in tuna because tuna is very high on the food scale. They eat everything else that's smaller, and fish that eat a bunch of other fish have much higher levels of toxicity in them than ones that don't. So, you know, if you're gonna have a piece of tuna, and if that's a regular part of your diet, please, please, please dramatically reduce that in your diet because you are setting yourself up. We know that it has high levels of mercury in it, and I don't want you putting mercury in your body, okay? So find some other ones that are good, and we can chat about that. And you can see some of the other ones. Sardines, little fish, that's what you want. You want stuff like that, okay? Or you want stuff that's gonna be much lower on the food chain. Raw milk, eggs, caviar, and mushrooms are all great sources of it as well. So how much do you need? Well, here's the Cliff Notes. It's on a scale of 0 through 100. And most of my patients in the last 25 years, when we got their blood work checked for them, they were a 15. Okay, 15 means you're ridiculously low in vitamin D. So you got to get your levels up. Doesn't mean you have to know your blood level to start taking vitamin D, but I want you to get your blood levels checked because it's super important so you know where you're at so we can get you to an optimal level. All right, if you want to be normally healthy with your medical doctor, then you want to get up to about 30 to 35. But if you want to be optimally healthy in your body to the best of your ability, and that's usually the people that are a part of our group, they want optimal health. They want a natural approaches to their health as much as they can. They want to reduce their drugs intake, and they want to do this from a natural perspective. You want to be going, and your goal should be 75 on that scale. And usually to do that, it takes about 20,000 IUs 3 to 4 times a week. And you're going to have to do that for probably about 4 months. So, because that's what I did. I was at 33 when I started. I got up to 83. It took me about 4.5 months to do that. So if you have questions, I'm happy to answer that for you. But I was getting my blood levels checked every 2 months because, you know, you want to make sure your liver is okay and it's happy while you're doing that. All right? So I hope that you learned something new today. You know, work on this to try to bring you a lot of great information so you feel like you can make informed decisions about your health and keeping yourself healthy. I hope I added some new stuff, and if I did, I hope you'll subscribe to our YouTube channel, follow us on Facebook and Instagram as well. We're always putting new stuff up. We got some really cool stuff that we're doing here in the next month to 2, so keep an eye out for those as well. We'll be doing our big launch in February, so super excited to help people with that. I hope you'll share this with people that you love. Everybody needs to know this information because most people do not know anything about vitamin D, so please, please, please share this with people that you care and you love about. And it was great to have everybody here as always. And hi Marisa, it's great to have you here as always as well. I hope you guys have an amazing day. If you have questions, DM me. Happy to answer those for you. And stay warm. It's cold here in Atlanta today, 20-some degrees, but it's pretty. And we will see you next